let's talk about risks because all surgeries have risks. So the things that you will most definitely have is you will have a scar. We try to hide that, but there's always a risk that you can have a complication with your scar, as it being painful, it getting stretched out and thicker, developing hypertrophic or keloid scars. And so if you're prone to getting those kind of things, make sure to tell me so that we can talk through those options. The other risks that you have are that you're going to have some pain. You're going to have some bleeding during surgery. That's why we check your hemoglobin before surgery, make sure you're teed up and ready to go. There's also a risk of wound healing complications. That's why we limit some of the liposuction and other types of things that we do during the procedure to decrease those risks. But the most common area that we have wound healing complications is right around your belly button, especially in our patients that have a BMI of 30 and more. So if you have a higher BMI, know that you are at a little bit of an increased risk of getting some wound healing complications. Also, if you have diabetes, if you smoke, all those kind of things can also increase your risk of these complications. Very rarely we have patients who have infections. We do everything that we can in the operating room and afterwards to decrease your risk, but the things that you can do to decrease your risk is make sure that you're keeping that area clean and dry, making sure that you're showering using regular soap, not using loofahs or bar soap that can carry bacteria, not allowing pets in your beds, all those kind of things. The other risk that you can have is some numbness. We are cutting through some of the nerves in the lower part of your abdomen, lifting everything up, pulling it nice and tight, and bringing it back down. Almost everybody has some numbness after surgery. Most people have it come all the way back afterwards, but a lot of people do have some numbness kind of in the lower area of your abdomen, and you can almost expect that. Other risks that you have are developing a hematoma or a blood collection after surgery. While this is very, very rare, it may be something that we may have to go into the operating room to correct afterwards. Almost everyone's going to have a little bit of asymmetry, little areas of kind of lumpy bumpiness. We try to minimize those, but those are very common. Most people are not completely symmetric before surgery, nor are you going to be completely symmetric after surgery. And so these are things almost to expect. The other biggest risk, the one that we want to prevent the most, because all of those other risks are little things that we can totally get over, are going to be completely fine. But we want to make sure that you don't get blood clots, because those are the things that can be very dangerous. And so we will do a Caprini, which is a risk assessment score, to see what your risk of getting blood clots is. And if you're on the higher risk of that, we will prescribe you a antithrombotic or a blood thinner medication to decrease that risk. It's also important that you yourself make sure that you're getting up, walking, pumping those legs, keeping hydrated so that you help us decrease your risk.